Hi, my name is Sofia Correa and I'm gonna talk to you a little bit about the diaphragm. We are gonna start with the definition. As we know, there are two different types of diaphragm, the one that's the thoracic diaphragm and the one that's located in the pelvis. The thoracic diaphragm, or simply the diaphragm, is a sheet of internal skeletal muscle that extends across the bottom of the rib cage. Here we're gonna watch a little bit about the structures that perforate the diaphragm.
5. Diaphragm structures. What structure perforates the diaphragm at the level of T8? At the level of T8, the diaphragm is perforated by the inferior vena cava. What structures perforate the diaphragm at the level of T10? At the level of T10, the vagus nerve and esophagus are what perforates the diaphragm. What perforates the diaphragm at the level of T12? At the level of T12, the diaphragm is perforated by the aorta, thoracic duct, and the azygos vein. What is the mnemonic to help you remember that these three things are what perforates the diaphragm at the level of T12? To help you remember this, just remember the rhyme at T12, it's red, white, and blue. Red for the aorta, white for the thoracic duct, and blue for the azygos vein.
We're going to continue with applications in medicine. The diaphragm is going to separate the thoracic cavity containing the heart and the lung from the abdominal cavity. It is also going to perform an important function in respiration. As the diaphragm contracts, the volume of the thoracic cavity increases, and the air is going to be drawn into the lungs.
The primary muscle of respiration is the diaphragm. The diaphragm is a thin, dome-shaped layer of muscle and tendon that separates the abdominal cavity from the chest cavity. It gains its shape from its attachments and from the organs that surround it, especially the heart, lungs, and liver. The diaphragm attaches at the costals along the lower rib cage, high in the front at the sternum, and deeply in the back along the spine. The diaphragm also attaches to itself via a central tendon, making the diaphragm one of the unique muscles of the body. The diaphragm uses its central tendon and its attachments as leverage to flatten during inhalation. The expansion of the ribs comes from the resistance of the internal organs to downward movement. As the internal organs are slow to move, the ribs expand to make room for the lungs. While the diaphragm attaches at the bottom of the ribs, its range of motion never reaches that low in the body. As seen from below, we get a sense of the full range of motion of the diaphragm as it would glide over the aorta, the vena cava, the esophagus, and the internal organs.
We continue with applications in medicine, and we're going to show you a respiration demo.
This is a demo video for complete respiration in the 3D diaphragm. Here is a sample animation showing the heart and the movement of the diaphragm. This movement of the diaphragm allows the lungs to change volume, bringing in fresh air and expiring old air. The movement of the diaphragm also displaces and massages the internal organs.
Diaphragm. We have other applications in medicine. The diaphragm is also involved in non-respiratory functions, such as helping to expel the vomit, feces, and urine from the body, by increasing intra-abdominal pressure and by preventing acid reflux. Pros of the diaphragm. Having a healthy diaphragm improves the patient's life significantly since they can have a better respiratory system. This is an advantage for the patient by letting them enjoy a normal life with high intense exercise and physical activities without having difficulty breathing. Here we're going to show you some benefits of deep breathing.
Your lungs expand to bring in life's essential gas, oxygen, from the air. Expanded lungs naturally contract to expel the body's waste gas, carbon dioxide. Your lungs usually expand and contract in two main ways. One is an unconscious downward and upward movement of a thin muscle called the diaphragm, which separates the chest from the belly. The other way is by raising or lowering the ribs to increase or decrease the volume of the chest cavity. We breathe in or inhale when the diaphragm contracts. This pulls the lower part of the lungs downward. When we breathe out or exhale, the diaphragm and lungs relax and return to their resting positions. Quiet, deep belly breathing is a more consciously controlled breathing that, with practice, can become the standard way you breathe. Deep belly breathing aids the diaphragm muscle movement by expanding and contracting the abdomen, the area below the diaphragm. This allows the belly muscles to push stomach and diaphragm up, which forces out more carbon dioxide waste.
Now we're gonna show you cons of diaphragm. Here we have some discomfort or difficulty breathing. We're gonna have pain chest, shoulder or abdominal area. Hypoxemia and paralysis. This is in rare cases. Some people think that hiccups is a disease, but it's actually caused by an irritation of the diaphragm. Here we're going to show you some causes of hiccups.
Hiccups are not a disease, but rather a symptom that happens when the diaphragm, or the breathing muscle, or the nerve that controls breathing, the phrenic nerve, becomes irritated. Hiccups are common. Everybody gets them. The cause of a short episode of hiccups is unknown, but believed to be harmless. Long episodes or recurrent episodes of hiccups may have a more concerning cause. Some medical problems that can be present with hiccups are pneumonia, diseases that affect the covering of the lung, pleurisy or lung tumor, uremia, which is kidney failure, gallbladder infections, hepatitis and other liver diseases, infections or problems, pregnancy, spread of cancers to the pleura, the covering of the lung or the diaphragm, and any abdominal infections such as abscess or collection of pus that in turn irritate the diaphragm. The physician caring for you today believes that it is safe for you to go home. He believes the hiccups are not caused by a dangerous cause. However, more thorough workup might need to be done by your primary care physician to rule out other underlying medical problems.
Here I'm going to show you a fun fact. In some non-humans, the diaphragm is not crucial for breathing. For example, a cow, it can survive fairly asymptomatically with diaphragmatic paralysis. So they can actually live without a diaphragm. Diaphragm diseases. About 11% of the people have a diaphragm disorder, and that is caused by the heart surgery. Symptoms vary based on the disorder. A typical disease of the diaphragm is the paralysis. The phrenic nerve, cervical spine, or the brainstem is damaged, and this will serve the nervous supply to the diaphragm. The most common damage to the phrenic nerve is by a bronchial cancer. What is a paralyzed diaphragm?
We breathe with two functions. One is that the chest wall expands. Secondly, the diaphragm contracts and pulls down in the chest. Both methods get the lung larger and pull air into the lung. That's how we breathe. That's how we get oxygen into the bloodstream. Some patients, for a variety of different reasons, will develop paralysis of usually just one diaphragm. When that happens, the diaphragm moves up higher and higher in the chest. The lung on that side is compressed, so it cannot expand, and patients have difficulty breathing. We can do an evaluation to find out what the cause is. Many patients have no obvious cause that we can identify. We wait to see if the nerve that goes to the diaphragm will recover and the diaphragm starts working again. If it does not, there's a minimally invasive operation that we can perform.
Here I'm going to show you two different types of paralysis. The non versus the paralyzed diaphragm, which is the normal, and the damaged diaphragm, and the unilateral diaphragmatic disease. First, we're going to start with the normal diaphragm. Diaphragm and the liver. So this is how it usually works. Now we're going to continue with the paralyzed or the damaged diaphragm. Now I'm going to show you the unilateral diaphragmatic disease.
It's 2:45.
Diaphragm diseases. This is the second diaphragm disease, which is a common one. Most of the people suffer from this, which is a herniation. Congenital herniation is not as common as the normal herniation. A herniation is a hole in the diaphragm that allows the abdominal contents to move into the chest cavity. The treatment is usually surgical. The posterolateral diaphragmatic hernia or the Bogdalic hernia is the most common congenital herniation. Most of them occur on the left side of the diaphragm.
A congenital diaphragmatic hernia is a birth defect in which an abnormal opening in a baby's diaphragm allows abdominal organs to move into the chest. The diaphragm is a large dome-shaped sheet of muscle that separates the chest from the abdomen. When the baby breathes in, the diaphragm and outer rib muscles contract, expanding the chest cavity. This expansion lowers the air pressure inside the chest, creating a pressure change that causes air to rush into the lungs. When the baby breathes out, the diaphragm relaxes and the inner rib muscles contract, reducing the size of the chest cavity. This reduced size increases the air pressure inside the chest, forcing air out of the lungs. For unknown reasons, the diaphragm in some babies doesn't develop completely before birth, resulting in an opening between the chest and abdomen. The most common location for this opening is on the left side of the diaphragm near the back. The baby's abdominal organs can push through or herniate through this opening in the diaphragm and compress the lungs. As a result, the lungs do not develop fully, causing the baby to have significant trouble breathing right after birth.
Thank you very much.